There are more people living with HIV than ever before, an estimated 34 million people worldwide. Advances in science and medicine have curbed AIDS-related deaths, but as the epidemic changes, we face new challenges in securing the availability, quality, and effectiveness of HIV treatment and prevention. Funded by the U.S. Agency for International Development and supported by the President's Emergency Plan for AIDS Relief, Research to Prevention, or R2P, has used a global portfolio of research to identify and evaluate interventions for populations most affected by HIV.
I think R2P is unique in its scope. So we have over 30 different projects in multiple countries around the globe, although we're focusing most on sub-Saharan Africa because that's where the greatest burden of HIV is. But we're also looking at community level factors and contextual factors. We're looking at biomedical issues, we're looking at behavioral issues, and we're really thinking holistically about a wide variety of different HIV prevention research questions.
With 30 projects across 18 countries, R2P was designed to translate research into action through three main goals. First, conducting research in the countries and populations at greatest risk. Second, promoting the use of data in programs and policies. And third, building capacity among partners.
There have been significant recent advances in the field of HIV prevention, particularly on the biomedical front, including treatment as prevention and male circumcision. R2P recognizes the importance of these advances, but really seeks to understand the how, the implementation science around rolling out and promoting the uptake of these strategies.
Armed with information on what works in biomedicine, R2P has explored the uptake of effective interventions such as voluntary medical male circumcision.
Much of the research on voluntary medical male circumcision has focused on the impact and its ability to avert HIV infection. There's been relatively little on studying the actual implementation of these services.
In a study referred to as CIMAX, R2P researchers undertook the first large-scale assessment of voluntary medical male circumcision service delivery in 4 countries. By collecting a vast amount of data in Kenya, South Africa, Tanzania, and Zimbabwe, CIMAX has provided key data on the feasibility of these large-scale initiatives. At the behavioral level, R2P has attempted to explore new ways of reaching populations at greater risk for HIV infection. This was the case in Botswana, where high HIV prevalence and rising rates of alcohol abuse created unique challenges to prevention efforts.
So the goal of our study in Botswana, our R2P study, is to look at both HIV prevalence as well as risk factors of HIV amongst patrons attending alcohol venues, and these are bars, recreational areas that are in Gaborone, which is the capital city of Botswana. And in this particular case, they came up with an innovative idea to do HIV testing in alcohol venues. And this provides potentially a very different but more attractive venue to a subset of the population.
R2P also prioritizes key populations that are often overlooked in policy and programming.
Through R2P, we've been able to place additional focus on marginalized and vulnerable groups and really come to understand the social context of their prevention and treatment needs.
In Swaziland, we have 2 different research projects that are complementary to each other. We're doing an HIV prevalence survey among key populations. We're talking about bonnet-driven sampling. And then we're also doing a complementary qualitative study where we've been doing interviews and focus groups with men who have sex with men and sex workers in Swaziland who are living with HIV themselves, and talking to them about what their HIV prevention and treatment and associated needs are, and how those needs might be different or particular for them compared to the rest of the population in Swaziland.
R2P studies were designed with the end in mind. researchers think directly about how to translate research into action.
The R2P team, together with USAID, has placed a great deal of emphasis on communicating and translating our findings to a variety of audiences. We've been lucky enough to leverage the networks of USAID, of Johns Hopkins, and of our partners in the field to develop ways to get the word out about R2P. So in some cases, this meant developing media-based activities such as a webinar or a Twitter chat that are meant to reach a broad audience. And in other cases, this meant working directly with the organizations in the field to figure out how to disseminate and utilize study results in the way that best benefited them.
Already we're seeing the results of CIMEX. To take the example of Zimbabwe, previously only medical doctors were authorized to perform VMMC.
Based in part on R2P research showing the benefits of shifting this task to nurses, Zimbabwe announced in January 2014 that nurses may now perform this procedure.
When we held dissemination meetings in Swaziland, the HIV prevention community, from the Ministry of Health to a variety of different NGOs and organizations working on HIV, were really receptive to our findings. And I think it's helping to shape how government officials and others in Swaziland think about how they should be responding to HIV in their context.
Whether conducting research or communicating results, R2P staff has shown a commitment to building capacity and empowering partners in the field.
It's really important and critical, first of all, that the focus of many of these research initiatives have to have a component of local capacity building, and that we empower or endow in these local partners by working with them specific skill sets to help them both with the analysis of paper, interpretation of the findings, as well as translation of these findings and dissemination of these findings.
There have been few initiatives at a global scale that encompass such a broad scope as R2P. 30 projects, 18 countries, cross-cutting biomedical, behavioral, and structural factors. So this portfolio in its aggregate offers a tremendous amount of insight to the field of HIV prevention.
I think R2P is a great example of implementation science at its best, where research is tied very directly to programs and specifically the needs that those programs have to do research that will then inform future development of those programs. One of the things that researchers really can learn from this type of implementation science is how to make their research results not just relevant to other researchers and knowledge in a field, but directly relevant to programs and countries implementing on-the-ground work.